Good morning, good afternoon, good evening. So, this is lesson number 12, Sexual Assault Investigations. So, what is a sexual assault? Well, it's the non-consensual sexual contact with another person. So, a person without permission touches intimate parts or penetrates intimate parts of another person without consent. So, what are intimate parts? Well, on a female, it would be the vaginal area, the anal area, the buttocks, and the breasts. On a male party, it would be the penis, the anal area, and the buttocks. So those are considered intimate parts, whether it's flesh to flesh or someone touching outside of the clothing on those same areas. So keep that in mind. So that's what a sexual assault is. And there's different levels of sexual assault. There's felonies, as most people call them, rapes. And they go all the way down to just inappropriate touching or groping. And I'll just kind of quickly explain some of that. A felony sexual assault with penetration, worst case scenario is where there's intimidation or force used, and there's vaginal or anal or oral penetration by the suspect on the victim against his or her will. So, if there's a weapon used, that aggravates the crime sometimes. But that's a full-blown rape, which is the layman's term. But usually it's considered first-degree sexual assault in most statutes. Now, there can be intimidation, force, and all that without penetration, and it can still be a felony. So that could be forced fondling of the breast, the vaginal area, the buttocks, that type of thing. Or it could be where the victim is forced to touch the intimate parts of the suspect. Let's use an example of a situation where maybe a male party takes a female's hand and places it on his crotch area, whether outside the clothing or with his penis exposed, where her hand is actually on his penis. So it can be either way. The victim can be forced to touch the suspect's private areas, intimate parts, or the suspect is touching or penetrating the victim and their intimate parts. So those are felonies when it's forced, non-consensual. There can also be non-consensual just touching. Like I just mentioned, it could be outside of the clothing, where the male party has the female's hand in his crotch, outside of his jeans or pants. That's still a sexual assault, and it's non-consensual. And it can go the other way, where a male party gropes the female's breasts outside of her clothing, or her buttocks, or her vaginal area outside of her clothing against her will, without her consent. That's still a sexual assault. And obviously, any sexual contact with a child is a felony. And we've talked about that in the past in another lesson, that a lot of states say the age of consent is 15, and that can vary a year either way, depending on the state. But when an adult, who is usually 18 or over, has sexual contact with a child, someone usually under 15, that's going to be a felony. And that can be the touching either way, victim to suspect or suspect to victim, inside their clothes, or touching them outside of their clothing. Sexual assault on a child is just not something we tolerate. Now, let's assume that we have a freshly reported sexual assault where there was intimidation and there was penetration, and the victim, a female in this case, reports it immediately. By immediately, I mean within the first hour or so. And she knows the suspect or has a good description of the suspect. And you're called to the scene. What is your first job? Well, we've talked about this before. Care for the injured. Well, in this case, we have a victim that's been sexually assaulted. You're not going to do an in-depth interview with that person. Let's say you're called to her apartment, and that's where the assault occurred. Well, you're going to secure that scene, and you're going to get her to a hospital as quickly as possible so that a sexual assault examination can be completed. Now, you're securing the scene because there's going to be trace evidence. Remember that theory of transfer that we talked about. So that suspect would have left evidence at that scene. Let's say it happened on the couch. His semen could be there, fibers from his clothing could be there, DNA just from sweat, that type of thing could be there, or hairs could be there. So you're securing that scene. And you're just going to do a basic, quick interview with her to identify the suspect and get the basics of what happened. So the who, what, when, where, why, and how, and then get her to a facility where she can be examined. You're not going to do an in-depth interview right away with that victim. Hopefully you've got a sane nurse, a sexual assault nurse. We call them sane nurses. They're specially trained and court-approved to do these exams, and they take swabs, vaginal, anal, oral swabs. They know how to collect the clothing without losing any of the evidence, and they know how to properly package the evidence for court and turn that stuff over to law enforcement. And then again, we've got that chain of custody issue that we've talked about in the past. So hopefully you've got a sane nurse at your hospitals. If not, a doctor or regular nurse will do that exam. And every hospital has the equipment to do this. And then that's turned over to law enforcement and sealed and dated and all that stuff, that chain of custody. And then it's usually refrigerated until you can get it to the lab or send it to your state lab or whatever lab you're using. Now, if the victim was able to give you the name of the suspect, actually knows the suspect, or gives a good description, and you have probable cause from what you've learned just from her to make an arrest, you should do that as quickly as possible. Because keep in mind the theory of transfer. He took stuff from the scene also. He would have taken her DNA probably away from the scene, or fibers from her apartment. And the sooner you can pick this person up and get them in custody, basically, the more evidence you're going to obtain. Your standard operating procedures, your policies, and we've talked about those, they're going to spell out how you handle this sexual assault suspect upon an arrest. So his clothing, or her clothing in some cases, needs to be collected. Your SOP or policy manual is going to tell you how to do that. And again, if you've got sexual assault detectives, they'll come in and take care of that. But you can't lose anything that's on that clothing. Her DNA can be on his underwear, on his clothing, that type of thing. So you can collect that stuff because he's in custody and he's going to be jailed if you've got probable cause. But as far as taking other evidence, like oral swabs, hair pluckings, those type of things, and those are usually, taken by a doctor again. And those pluckings are taken from the pubic area and from the head and other areas of the body. And they take a lot of them. Cut hairs don't work. They need the roots for DNA comparisons and that type of thing. So you probably need to get a warrant, or maybe even a waiver would work in some situations if the suspect is cooperating. Now, that brings us to a difficult case, what we call a he said, she said case, where the suspect is actually admitting to the sexual contact, but says that it was consensual. I'll go ahead and finish talking about that, and I'm going to get back to the interview of the victim. So let's say that we do have a situation where you've contacted the suspect and he goes, yeah, I had intercourse with this girl a few hours ago. Yeah, we were on a date. We went to her apartment and, we had sex. And what's going on? That's pretty common. It's what, the public calls date rape. Now, for it to be consensual, the victim has to know what's going on. So if he or she were highly intoxicated, maybe semi-conscious or unconscious, or drugged, there's the date rape drugs, and that sexual contact or sexual assault occurred when she was in a condition where she couldn't even comprehend what was going on, that's not consensual. No matter what happened before that. Maybe she was being physical with the party before that. But at some point when she becomes unconscious or too intoxicated to know what's going on or drugged, that's not consensual. Now, at this point I want to say that no means no and stop means stop. So again, a lot of date rape situations start out with a date, picked up at a bar or whatever it might be, and maybe there was some physical kissing and hugging and that kind of thing going on, but at some point the victim says, no, stop, I'm not doing that. That's critical. Stop means stop and no means no. So no matter what happened before, at some point when the victim wants to stop and the suspect continues and there's touching of the intimate parts or penetration of the intimate parts, either way, that's sexual assault. So let's get back to the victim interview. So you are just doing a very cursory who, what, when, where, why, and how at first, and get her evidence collected at the hospital and get her clothing. And then you're going to do a scene search at her apartment, in the case that we talked about earlier. And you're going to be collecting the bedding, or maybe the lab will vacuum the couch if it happened on the couch, that type of thing. That's where it's good to have a lab that can come in, and those technicians have all the equipment to do proper collection. If you don't have that, you just have to do the best you can. There's several ways to collect evidence off of upholstery. Like packing tape, just clear packing tape can be used to pick up hair fibers and stuff off of upholstery. Or if there's cushions on that couch or whatever it might be, you could actually just recover those cushions and put them in large bags and preserve them. But again, if you've got lab techs, you're much better off. So interviewing her after this sexual assault exam is done and she's released from the hospital, you want that advocate that you hopefully have called in. Hopefully you have a paraprofessional advocate that works with victims of sexual assault and domestic abuse and that type of thing, to stay in contact with the victim until you can arrange what we call a forensic interview. And most areas, large departments have them inside their department, specialized people that are court approved to testify in court and to interview suspects of sexual assault and interview children in sexual assaults and other types of assaults or neglect. So hopefully you have access to that, and they videotape these interviews. You can't ask leading questions, at what point in the date did Bill penetrate you vaginally? You can't ask those kind of questions, or these people don't ask those kind of questions. They ask open-ended questions like, what happened next? Or how did you end up at this location? Open-ended questions, and something you need to remember too when you're interviewing anyone. So hopefully within 24 hours or so you can get your victim to a center, an advocacy center, where they specialize in these interviews, these forensic interviews, and they film them, and then that many times will save the victim from having to relive the crime by being interviewed again and again, and even may save the victim from having to go on the stand in open court and testify with the suspect in the room with her. Many times the defense attorneys will do a deposition with the victim where they're free to interview her in a setting where it's recorded. The prosecutor is usually there, and actually some places actually allow the suspect to be in the room, which is very intimidating to the victim. But she may have to relive it again with the defense attorney. A lot of that depends on how much information is gained from that forensic interview. It may be so convincing, and then you've got physical evidence to corroborate, or you may have some admissions from the suspect to where the defense attorney realized we're not going to go to court with this. We're going to try to do a plea bargain and do the best we can for our defendant. But you're not going to usually do those in-depth interviews. So, very important cases, obviously. If you have PC, get your arrest as soon as possible. You don't want the suspect to be able to get rid of his clothing, wash them, come up with an alibi, meets with a buddy and says, hey, I was with you all night. I never was at that party or at this girl's apartment or whatever. And so you don't want to give them time to think and come up with alibis and excuses and destroy evidence. So keep all that in mind. You want to pick up that suspect and get the clothing as quickly as possible. And of course you want to know what clothing you're looking for. You need a good prosecutor on sexual assaults. Many times sexual assaults are not reported right away. It may be days or even months before they make that report, and that complicates things. But due to the embarrassment of the situation, it's not unusual that they're reported, as we say, cold. So the victim would have showered maybe a number of times, clothing could have been washed, bedding could have been washed, and all that. So a lot of evidence gets destroyed in those situations. But that doesn't mean you don't do the best you can to do a thorough, complete investigation. And that's where you need aggressive prosecutors. And again, it comes back to what you do when you're first contacted, whether it's that fresh sexual assault that we talked about at first, or if it's someone who comes to you months later and says, this happened to me a couple of months ago when I was on this date. That doesn't mean it didn't happen. It doesn't mean it's not just as serious as if she had come in immediately. It just makes the case a little more difficult. But the statute of limitations allows for that to happen. And in fact, sexual assaults can be reported many years later, sometimes indefinitely, depending on the state, because of the sensitive issue. And we're seeing this a lot with some of our politicians and some of our high-level executives at different businesses and the Hollywood scene and all that. We're having a lot of this Me Too movement going on, where women are coming forward and telling what happened to them years ago by powerful people. And they were intimidated by these people. So it's not that unusual. And right now there's a couple of these cases in the courts, and some people are, trying to defend themselves. So, again, back to my point, what you do, whether it's a cold case that may have happened years ago or a few days ago, or it's fresh, what you do as the first arriving officer or the first officer receiving this information is critical. So you take all of these lessons and you put them all together, and you do what your policy and procedure manual dictates and what you're trained in the academy to do, and you'll be fine. So that's just a quick overview of a sexual assault investigation. So please hit the like button if you are enjoying these or learning something from these, and I need people to subscribe to my channel, and I will be back with another lesson very soon. Have a good day.